Greetings everyone. My name is Farnoosh Kadri and I'm a third-year resident physician in obstetrics and gynecology at Beaumont Hospital, Dearborn. Today I'm presenting our research on comparison of open and minimally invasive management of cesarean wound complications. To give you some background, according to 2018 CDC data, there are about 3.7 million babies born in the United States every year. 31% of those are cesarean deliveries, and 11% of these deliveries are complicated by surgical site infections. Optimal management, however, is unknown. Our study focuses on superficial incisional surgical site infections, which are defined as infections within 30 days of the surgery, and they are limited to skin or subcutaneous tissue. Seroma is a type of a superficial incisional surgical site infection which involves collection of a serous fluid within the skin or the subcutaneous tissue. Other types of surgical site infections are deep incisional and organ space surgical site infections, but we have not studied those in our research. Superficial incisional SSI management includes open surgical drainage, which is then allowed to heal by primary or secondary intention, or wet or to dry dressing may be done, or an image-guided drainage done under CT or ultrasound guidance. Both of these methods can be combined with antibiotics. Our question is, what is the best option for a new mother who has to deal with the emotional and financial burden of developing a complication after cesarean delivery? We hypothesize that an image-guided drainage is associated with improved outcomes for our patients, lesser pain, lower readmission rate, lower need for home care, and improved cosmetic results. Now I would like to briefly describe the methods that we used to test our hypothesis. We conducted a retrospective chart review. 2,000 charts were identified using ICD-10 codes and keywords. 25 of those charts met inclusion criteria, 17 in the open surgical and 8 in the image-guided group. The inclusion criteria were women of reproductive age group who had a cesarean section within 30 days of the hospital admission and a fluid collection that was more than 3 centimeters on CT or ultrasound. The study period was between January 2010 and December 2018. Our study was approved by Beaumont IRB. So what did we find out? We discovered that about 76% of our patients had a BMI greater than 30, and 60% of our patients had a pre-existing condition, which we defined as diabetes, hypertension, or chorioamnionitis. The demographic characteristics between the two groups, the open surgical and the image-guided, were similar, with the exception of age. The patients in the image-guided group were significantly older than the patients in the open surgical group. On evaluating the primary outcomes between the two groups, it was found that a significantly lower percentage of patients in the image-guided group were discharged home with a prescription for opioid pain medication. Thus, patients with a surgical site infection, when managed in a minimally invasive manner using an image-guided drainage, require less opioids upon discharge as compared to patients who are managed with an open surgical technique. Image-guided drainage was also associated with a lower readmission rate and home care need. However, it was not statistically significant. The open surgical group was associated with a lower length of stay and number of antibiotics. This result was also not statistically significant. Another important finding was that the open surgical drainage emerged as the predominantly more common method of management, which is what we had expected. What are the important conclusions from our study? Image-guided drainage is less painful, and this translates into improved patient outcomes. There's also a lower risk of persistent opioid use after surgical procedure, and this is especially important in light of the opioid epidemic. Although limited by the small sample size and retrospective nature of the study, image-guided drainage was associated with lower readmission rate and lower home care needs, and these findings definitely deserve further study. Superficial surgical site infections are common after cesarean deliveries, and the usual management involves open surgical drainage, and some of those techniques like wet to dry dressing are obsolete. There are no large studies about image-guided drainage in obstetrics. And our study shows that image-guided, minimally invasive drainage is less painful and has potential for other benefits and can be first line in obstetrics. In the end, I would like to thank you for your encouragement and your kind consideration. I'd like to thank Doctors Manzoor Shihab, Hind Al-Azavi, and Sanjana Kulkarni for their valuable contributions, and none of the authors have any financial disclosures. Thank you again, everyone, and have a nice day.